Committee of Supplies please come to order? This section of Committee of Supplies now resume the consideration of estimates for the Department of Health and Seniors Care. As previously agreed, the questioning from this department will proceed in a global manner. Before we get going on questions, is the Minister and the critic ready for to continue?
I'm ready.
I am also ready.
Okay, the floor is open for questions. The honourable member for Flin Flon.
Well, thank you, everyone, and good morning to everyone, including the Minister. I guess we'll start off today with some questions specific to the Northern Health Region, and my colleagues from Thompson and Napaw will be joining in those questions as well. So I want to start off talking about public health nurses in communities like Lynn Lake and Leaf Rapids. A pretty important role that they fulfill, and my understanding is that both those positions are presently empty because both people that were in those positions have resigned. So can the Minister A confirm that those positions are empty, and B give us any insight on why both of them resigned basically at the same time, and what the Minister's plan is to fill those positions?
The Honourable Minister.
Thank you, Mr. Chair. I want to thank the member for the question. And certainly, I know when it comes to Leaf Rapids, there's some significant challenges there. I know the member is probably aware of those. We've had significant safety challenges. I know in other portfolios that I've held, we've sort of been working together across, justice, Indigenous and Northern relations, as well as health and families and other portfolios to try and address some of the challenges with those issues. These are nothing new. These have been going on for kind of decades up in the area. So certainly there has been some concern on, from a public health standpoint of people, within the community. And so, but it is very important, so it has been difficult to sort of recruit and retain healthcare professionals there. But certainly on an as needed basis and so on, there will always be people from that will be redeployed to help those individuals out who need it, to ensure that people get the access to the healthcare that they need within the communities.
The honourable member for Flin Flon.
Well, except what we've seen, particularly at Leaf Rapids, is what you've just said is not the case. People have not been redeployed. We were short one nurse who was, my understanding, an agency nurse who, for whatever reason, was unable to come to Leaf Rapids. So your government's plan was to just shut the facility down for 2 weeks and leave people in that community with zero access to health care. Nobody was redeployed until, thank goodness, the MKO stepped in and used some of their pandemic health people to step in and fill the void, left the place short for a little while. So really that plan isn't working. So we know that there's difficulties in staffing those positions. So what exactly has been done to find people to go to those positions? We keep hearing it's difficult, but we never really hear what the game plan is and how you're going to change recruitment, how you're going to change something to retain people. What is the plan for filling those empty positions?
The honourable minister.
Yeah, I just thank the member for the question again. It's obviously, and I know, I mentioned this before, but obviously it's been very difficult for the Northern Regional Health Authority to recruit to the area. And so in the interim, what has happened, and particularly when some services were to be suspended, MKO came in and were very interested in testing their sort of rapid response team, and were very interested in working collaboratively with the Northern Regional Health Authority. And so I think this is a prime way of how we can work with our Indigenous communities to ensure that people in the community can get access to that care. It doesn't mean that we're not continuing to recruit to the area. We'll continue to try and get people to the area. It has been, again, a very challenging issue, not just in healthcare, but other areas where we've been trying to recruit people to the community, but it's due to safety reasons. People are have been reluctant to move into the community. And so obviously this is a challenge, but I think where we can work with MKO, who is very interested in partnering with the Northern Regional Health Authority to get their help. They are interested in getting their rapid response team to have a sort of a test run and work in a collaborative way. I think this is a very productive way to look at how we can work together moving forward.
The honourable member for Flin Flon.
I certainly appreciate what MKO did to step into the breach, but that, unless we develop some kind of long-term plan between your department, the Manitoba government, the MKO, on some kind of permanent contingency plan, I don't see where just relying on their pandemic team to fill the vacancy is much of a plan, because they may very well be employed elsewhere. They've only got so many folks. But again, we never really come up with an answer as to what specifically are you doing to try and recruit people for the Northern Health Region, particularly when it comes to things like nurses and healthcare aides, well, doctors too, for that matter, I guess.
The Honourable Minister.
Thank you, Mr. Chair, and again, thank the member for the question. Certainly I know the Northern Regional Health Authority has been working for quite some time to try and recruit individuals to Leaf Rapids. There have been the challenges. I've outlined what some of those challenges have been. But I will say there has been, a very important part on the part of the First Nations communities surrounding the area of wanting to be involved and wanting to help people in the community. And I think that there are some very good opportunities. This was obviously a way to start where they wanted a chance to sort of test run their rapid response team in the community. And I think that has been positive. And I think to the extent that we can continue to move forward and on a collaborative approach to some of the solutions with ensuring that we get, the appropriate care for people in these communities is extremely important. And I know those First Nations communities are very interested in helping out. They've expressed that not just on the healthcare front, but on other fronts as well. And I think it's very important that we take them up on that we do work in a collaborative way to ensure that we can get people the care that they need. So again, that recruitment continues on the part of the Northern Regional Health Authority, but we'll continue to partner with MKO and others who want to help out and be part of a solution here. And certainly, if the member has any other ideas of how to approach the challenges that have been ongoing for decades in the community. I know he knows these communities well, and we certainly don't pretend to have a monopoly on good ideas. We certainly want to work in a collaborative way to ensure that we can recruit people and retain them in these communities, but that we also work with our partners in the surrounding communities. So I'm certainly open to any advice that the member may have on how we can work collaboratively here.
The honourable member for Flin Flon.
Well, I thank the minister for that, and certainly I've never been shy about sharing ideas. Unfortunately, to date, your government hasn't listened to any of them. And certainly, I want to thank MKO for stepping in, and certainly Grand Chief Settee has a vision for a more collaborative approach with the Northern Health Region, and I want to be a part of that approach to a new way of doing things. My concern is that this government's way of simply offloading costs onto someone else for the lack of attention, certainly since this government has come into being to properly fund healthcare in the North. Is it now the plan to offload that cost and call it a partnership?
The honourable minister.
Thank you, Mr. Chair. Thank the member for the question. And certainly, over last year, the dollars expended in the community on this particular area is about 1.4 million, and as of this year, it's about 1.55 million. So we are continuing to increase the investments in the community and the expenditures in the community to ensure that healthcare, takes place. But I think it's important to say that this collaborative approach with our First Nations partners is a positive thing to move forward on. And certainly, we're not looking to offload or anything like that. We're looking for partnerships, and I think that that's a responsible approach moving forward. And so, we continue to work with obviously the Northern Regional Health Authority, and I know they will continue to work with MKO and others who are willing to help out with those citizens within those communities. But by no means I don't want to leave the member with the impression that we're decreasing funding to the area. We continue to improve and make those investments that are necessary to ensure that we are able to look after the people in those communities.
The honourable member for Flin Flon.
I guess we could go on for quite a while talking about those two communities and what the long-term plan for their hospitals. But I want to just very briefly talk about the Flin Flon General Hospital and what the game plan might be going forward there. We've seen obstetrics disappear, surgical disappear. Is the government planning to continue to downgrade services in Flin Flon, which will mean less care closer to home?
The Honourable Minister.
Thank you, Mr. Chair, and thank the member for the question. And what I will say is part of this budget is, and the member opposite I know has read through it, and we have about $812 million earmarked towards capital upgrades in rural and northern Manitoba. So that includes an intermediate hub that will be placed in northern Manitoba. There's been no decision yet as to where that will take place in northern Manitoba. We'll continue to engage with northern stakeholders to see where that hub will be. And certainly what we want to do is ensure that through our clinical preventative services plan, who I know the member opposite is aware of, we want to ensure through these, while there will be an intermediate hub in northern Manitoba, we want to ensure through our clinical preventative services plan that obviously safety is paramount, but that Manitobans do have access and will have access to the services that they need closer to home. So that will obviously be a big component of this.
The honourable member for Flin Flon.
Interesting when the minister talks about an intermediate hub. I wonder if she could expound on how many conversations she's had or her department's had with the Saskatchewan government, recognizing that the Flin Flon Hospital services a large portion of population in northern Saskatchewan as well. It seems to me that between the Manitoba government, the Saskatchewan government, possibly the Peter Ballantyne Cree Nation, Matthias Colum Cree Nation, all of which traditionally use the services at the Flin Flon Hospital, along with Flin Flon, Creighton, Denair Beach, and some other communities, Cranberry Portage, that it would seem to be an ideal place to strike a collaborative approach to building something more at the Flin Flon Hospital to service both sides of the community. I've long suggested that perhaps an MRI machine in the north, and what better way or place to put it than in Flin Flon, where we can get several different governments involved in helping to pay not just for its installation, but for its ongoing operation. So perhaps the minister could tell us how many times she's had conversations with her counterparts in Saskatchewan, and whether any of those conversations, if there has been any, have talked about how to grow that facility in Flin Flon to become a true hub for not just northern Manitoba folks in Flin Flon, but for that cross-border entity that affects everything that takes place in Flin Flon.
The Honourable Minister.
Yeah, the member mentions, a very good point in terms of how we collaborate with our neighboring provinces. And certainly we have ongoing discussions, particularly, through COVID with our neighboring communities. And so, in this case, the member opposite is talking about Saskatchewan. We also have ongoing discussions with Northwestern Ontario and the Ontario government with how we can work in a collaborative way towards delivering healthcare services to citizens within our neighboring communities. And so those are discussions that are ongoing, very much a part of this. And I think the member has some very good points with respect to moving forward. We'll continue to work in a collaborative way with Saskatchewan, with Northwestern Ontario, to see how we can better deliver services between our communities.
The honourable member for Flin Flon.
So the minister has given basically a non-answer to the specific question that was asked. How many times has the minister actually had a conversation with any of those entities about building better facility, and not just the physical facility, but ensuring that services are there for both sides of those border communities that presently we don't see, that they've been cut in the interest of saving money, I guess, which means that not only don't people in Flin Flon have care closer to home, but that whole portion of northern Manitoba doesn't. That whole portion of northern Saskatchewan doesn't. So can the minister say specifically how many times she or her department has met with their counterparts in Saskatchewan to talk very specifically about services that can be provided at the Flin Flon General Hospital or the Flin Flon Center that could be something more than it is now?
I thank the member for the question. He seems to be fixated on, oh, sorry. Thank you, Mr. Chair. Thank you, Mr. Chair. The member opposite seems to be fixated on numbers of meetings having with, our neighboring partners. We have, many meetings on an ongoing basis. And to me, that question is somewhat irrelevant. But what I will say is that there has been many investments that have been made since we came into government with respect to our northern communities. And the point of this budget is to point out that we are committed to an intermediate hub in northern Manitoba, hundreds of millions of dollars that will be invested in that community, in those communities in northern Manitoba, to ensure that northern Manitobans have access to the quality health care that they need when they need it. This is something that was never done under the previous government. It is initiatives that we have taken. I know that we upgraded the emergency department in that Flin Flon General Hospital as well. Almost $24 million that was expended. I believe that was completed back in April of 2019. So to say that, we're not interested in northern Manitoba, that we're not, making investments and improving healthcare for individuals and Manitobans, and that the only way we can do that is based on the number of meetings that we have with our neighboring, provinces, really is quite irrelevant. What is relevant is that we are continuing to make the investments that are necessary within those communities, and we're committed to that.
The honour member for Flin Flon.
Just one last question before I turn the floor over to my colleague from Thompson. I'm fixated on people in the Flin Flon and surrounding area actually being able to have health care close to where they live. And since your government came to power, that health care has continued to degrade to the point where the new ER is little more than a nursing station. Is it the plan to keep the Flin Flon General Hospital operating as a full-scale hospital offering medical services to those communities, or is it this government's plan to downgrade it to something less than what it has been and what it even currently is? I mean, we've got a new ER facility that was committed to being built by our government when we were last in power. And thank the minister for carrying on with that construction project. But we need things to happen there other than just a building. We need to have doctors in Flin Flon. We need to have surgical capabilities in Flin Flon. We need to have day surgeries in Flin Flon. We need to have all those services that we've seen cut under this government. So can the minister explain, do they have a plan for what's going to happen to the Flin Flon General Hospital and health services in Flin Flon?
The honourable minister.
Yeah, no, I thank the member for the question. And once again, I know members opposite like to say, claim falsely, frankly, that there's less investments being made in Manitoba in healthcare. In fact, there's $750 million more that we are investing than the NDP ever did under their time. And so it's important to continue to correct the record when members opposite put those things on the record. What I will say is through our clinical preventative services plan, certainly areas like Flin Flon, the Paw, Thompson, northern communities, What we want to do is ensure that through our clinical preventative services plan that we're enhancing the access to healthcare within those communities. And within the plan itself, it states, and I'll just read for the member, it's enhanced diagnostic supports to inform care, including diagnostic services, critical care and acute medicine services with remote support and from provincial hub. These are obviously attributed to northern Manitoba. This is how we're enhancing the capabilities in the north by developing more enhanced care capabilities and improving access in the north. So also critical care and acute medicine services, which I mentioned, improved support for Indigenous health in the north in partnership with Indigenous communities. So again, that goes back to, and as an example, Leaf Rapids, where we are developing partnerships to help enhance access to care for individuals in those communities. New modes of patient transport for scheduled care. So that's assessment, diagnostic, pre-op procedures, and follow-up to enable better patient flow to within the north for non-urgent and intermediate care. So those are some of the things that we're working on for Northern Community. This is available and has been for some time, our clinical preventative services plan on the website. Member opposite should feel free to go to the website and read up on all the exciting initiatives that will be coming to Northern Manitoba as a result of us moving forward on the clinical preventative services plan. I'll also say beyond that, I did mention already about the emergency department redevelopment and how we expended more than $24 million. Those services will continue for those individuals in the Flin Flon community. And certainly, bringing an intermediate hub to Northern Manitoba is certainly, it's all part of our clinical preventative services plan, and it's all about providing better access to care for those in Northern Manitoba. So these are all positive developments. I know the member opposite doesn't like to hear that because it's coming from a conservative government that's making investments that were not made, frankly, back during the time of the previous NDP government. But we believe that we want to continue to work with Northern Manitobans. We want them to be involved in the discussion as to, where this intermediate hub will be, where is the best location. And we want to engage with our Northern stakeholders, including our First Nations communities, to ensure that we take the time to get that right. But by bringing this to the Northern communities, that will create better access to care for Northern Manitobans closer to home.
The honourable member for Flin Flon. Or no, the honourable member for Thompson.
One last comment before I turn it over to
The honourable member for Flin Flon.
The minister talks about this intermediate hub in the north. It would be akin to saying, well, we're going to shut every hospital in southern Manitoba down except Winnipeg and have a hub there, and everybody from southern Manitoba go there, because the minister has no concept of the distances and the transportation, communication, all those issues, that if you only have one hub in the north, it means that a lot of people aren't going to have proper care. So with that, I'll turn it over to the member from top.
The honourable minister.
Well, the member opposite needs to know and understand that we have existing facilities in Northern Manitoba. By bringing an intermediate hub it's enhancing. By bringing an intermediate hub into Northern Manitoba, it's enhancing the access to healthcare for people in those communities. We're not taking away other services and putting in an intermediate hub. We're recognizing that there is a need for more services there, and that's why we have identified that Northern Manitoba needs an intermediate hub. So we are continuing to do that. And the communities like Flin Flon and Napaw and Thompson, we'll get together to decide, and we'll consult with those in the communities, including our First Nation communities, about where is the best and most appropriate location for that intermediate hub. In the meantime, and continuing on after the hub is there, there will be access within these communities that the member is talking about So this is enhancing the access to quality care in Manitoba, unlike what the member opposite is trying to portray.
The honourable member for Thompson.
Thank you, Mr. Chair. So I would like to ask the minister some follow-up questions on the hub. Is there a timeline for when the hub is going to be announced? I know many communities are waiting, and there are a number of communities that have projects waiting depending on that announcement.
The honourable minister.
Yeah, the hub was announced in the budget.
The honourable member for Thompson.
Which location is going to be getting the enhanced hub?
The honourable minister.
Yeah, well, the member opposite will know what I've just said the last several minutes that I've been speaking about the intermediate hub in northern Manitoba, is that we believe in engaging with northern Manitobans throughout this process to ensure that we get it right in terms of what that location will be. We want to engage First Nations communities. We want to engage all communities in northern Manitoba to ensure that we hear from them, from those who live in those communities, where that should be. So we have not made that decision because there will be adequate and extensive and thorough consultation with members of the community.
The honourable member for Thompson.
Thank you. And once again, I go back to my question. Yes, it was announced in the budget, but what is the timeline to have which community announced? As there are many communities that have projects depending on that announcement.
The honourable minister.
Well, again, I will answer that question for the member that no decision has been made because it's pending consultation with those people from those communities.
The honourable member for Thompson.
Thank you. Will the MLAs from those communities be involved in those conversations as we are stakeholders in the community?
The honourable minister.
All members of people in those communities, including those, if you've got some ideas about what you want to bring forward, we're always open for those discussions. Absolutely.
The honourable member for Thompson.
So will the minister commit to meeting with the Northern MLAs to discuss this issue?
The honourable minister.
If the member has some ideas of her own, I welcome her thoughts on this. She's welcome to get those thoughts in writing to my office. I'm happy to have a look at that. Certainly right now we're in the middle of a pandemic. We are focused on ensuring that we're protecting all Manitobans. And so we will, and again, that's been our focus right now. But as we move forward with this consultation process, we will be reaching out to members of our northern community, to those who live there, to those who work there, to really get a thorough consultation process so that all Manitobans who live in northern Manitoba have a say in that, not just NDP MLAs.
The honourable member for Thompson.
Thank you. So now we're going to, I'm going to ask the minister about agency nurses. How many agency nurses are deployed with the Northern Regional Health Authority versus nurses that are hired and maintained in the community?
The Honourable Minister.
Yeah, the preferred option is obviously always to hire directly from those, into the nurses into the Northern Regional Health Authority directly. So that's obviously what the priority is and will continue to be.
The Honourable Member for Thompson.
Thank you. Seeing as the minister is unable to provide me with the number of agency nurses in the Northern Regional Health Authority, is the minister able to provide me with the number, how much was spent on agency care?
I will just for the record just say that the member did not ask, oh, sorry, Mr. Chair.
The Honourable Minister.
The member did not ask for the numbers in the first question around that I could hear anyway, and perhaps I missed that. But, what I will say is that when it comes to Northern Manitoba, I know that we have just announced 20 new spaces in the University College of the North diploma and Kaplan in practical nursing program for students in Northern Manitoba. We recognize, obviously, there are challenges with respect to hiring nurses in, directly into the RHAs, into the hospital situations in Northern Manitoba. But we recognize this is a challenge, and that's why we have announced those, and we are, those 20 new spaces in the University College of the North. So we recognize that there's some challenges, and we're starting and we're making investments to ensure that we can improve the situation of nurses in Manitoba, in Northern Manitoba.
The Honourable Member for Thompson.
Thank you. So I will ask the minister again, what is the number of agency nurses versus the number of nurses employed by the Northern Regional Health Authority, and how much was spent on agency care in the Northern Regional Health?
The Honourable Minister.
Thank you, Mr. Chair. And, what I will say to the member is, like I answered our last question, which is there have been challenges with the recruitment and retention of nurses, not just in northern Manitoba, but indeed all over Manitoba. This is not something that is unique to Manitoba either. This is a challenge that is being faced across the country. And this is nothing new. This is something that's been going on for decades, even back when the previous NDP government was in power. These are challenges that previous ministers of health under the previous NDP government acknowledged. I know it's easy for the member opposite to sit in opposition and talk about this all being a current issue and problem. I know the member is fairly new to her position as an MLA. But history is there, and it is what it is, and we continue to face those challenges. We will continue to continue to work with those regional health authorities, with shared health, and work with all Manitobans who want to be involved in how to help us recruit and retain nurses. There's been a number of initiatives that we have undertaken, one of which I mentioned already for the member, the 20 new spaces for the University College of the North's Diploma in Practical Nursing program. This is, I know that we recently just trained 60 new nurses for ICU capacity in Manitoba. There's been a number of initiatives that we've done in the recruitment and retention of nurses. We recognize that there's more work to be done. What I will say is that, yes, in northern Manitoba and in places not across the province and across the country, we do rely on agency nurses to fill positions to ensure that we have the adequate and appropriate care there for Manitobans when they need it. If the member opposite is suggesting that we shouldn't hire agency nurses to help ensure that we get the adequate care for Manitobans, that is very concerning to me, because that would be putting Manitobans' lives at risk. And I sure hope that the member opposite is not suggesting that we shouldn't hire agency nurses to look after Manitobans to ensure that they have the adequate protection and safety and health care that they need when they need it. I sure hope the member isn't saying that. But this is what happens when we have a recruitment and retention issue, which has been ongoing for decades. And we will continue to look to our partners, our agency partners, to help us through these times, especially in the middle of a worldwide pandemic, where we've had significant challenges, with respect to, things that have come out of COVID-19. And so, again, I would just say to the member opposite that, yes, we will reach out to our agencies to recruit agency nurses where they're needed. But obviously our first choice is to hire, nurses in our regional health authorities. That's our first choice. But out of an abundance of caution and for safety measures and ensuring that we deliver the health care that's needed for those individuals, we absolutely will partner with agencies to ensure that we have the nurses available to deliver the health care for those individuals who need it.
The honourable member for Thompson.
Thank you, Mr. Deputy Speaker. If the minister says that they have been aware for some time, what is the number and the amount? And if she does not have it, will she take it under undertaking and provide me with the number at a later date and the amount?
The honourable minister.
I believe I've already said to the member that if she is suggesting in any way, shape, or form that by reaching out to agencies to hire nurses is not an appropriate way to look after citizens in our province who need access to healthcare, That's a serious problem. And if the member opposite wants to put that on the records, then I suggest she does so. What I will say once again in answering the member's question is that we put a priority on the recruitment and retention of nurses within our RHAs and our hospital systems to hire within and directly. To the extent, and while we've got a number of programs and a number of plans out there that to address this issue right now, and we're always looking for for more ideas, and we will continue to move in that direction towards the recruitment and retention of more nurses in Manitoba, so we can hire them directly into through our RHAs. In the meantime, if the member opposite is suggesting that we shouldn't hire agency nurses to fulfill the roles and responsibilities that are needed to adequately care for Manitobans, I would suggest that that is a wrong approach. And so we will just have to agree to disagree.
The honourable member for Thompson.
Thank you, Mr. Chair. Seeing as the minister is unable and unwilling to provide me with a simple answer to my questions, I will move on and ask another direct question. How many life flight planes are available in Manitoba?
The Honourable Minister.
There are three.
The Honourable Member for Thompson.
Thank you. Thank you. I'd like to thank the minister for that direct answer. I would now like to move over to the Lynn Lake, Leaf Rapids, Gillam sharing a facility manager. How is that going to work, seeing as those communities are far apart on different highway systems and Lynn Lake and Leaf Rapids don't have cell coverage? So if the manager is in Lynn Lake or Leaf Rapids and there's an issue in Gillam, how are they supposed to respond?
The Honourable Minister.
Yeah, what I will say to the member is that I think there's many instances where managers are managers of multiple facilities, and they're not just a manager of any single facility. But the member opposite does bring up obviously a good point with respect to access to internet services and cell coverage in rural and northern communities. And I know we did make an announcement yesterday as a government in a partnership with ExploreNet to improve the connectivity to hundreds of rural, remote, and Indigenous communities throughout Manitoba. So it was a memorandum of understanding that was signed on the agreement. The province and ExploreNet will provide broadband services to nearly 30 First Nation communities, approximately 270 rural and northern communities, and additionally, this agreement will also serve 350 communities with cell phone access So that was just announced yesterday. We obviously recognize that has been a challenge in some of our more remote communities, and those are some of the actions that we're taking to address those issues.
The Honourable Member for Thompson.
I'd like to thank the minister for that response. I'm going to ask one more question pertaining to vaccine rollout, and then I will be handing it over to my colleague from Kawatnuk. We have heard from many northern communities the lack of engagement from this government on vaccine rollout. Many communities have reached out to let us know that the pop-up clinics that have been happening have been on short notice. There's not been enough time to get community members advertised enough within the community. I know the other 3 northern MLAs have sent repeated letters to the minister asking for a meeting regarding vaccine rollout to address the concerns we have heard, and the minister refused to meet with us regarding those issues. So can the minister please commit to providing more knowledge and more transparency and more working with the Northern Regional Health Authority on vaccine rollout to ensure communities are able to get their citizens vaccinated quickly, efficiently, and effectively?
The Honourable Minister.
Thank the member for the question. And first of all, regarding a request for a meeting with myself, that we actually got an even better meeting for her caucus, which was with the Leader of the Opposition and the health critic this week with Dr. Brent Rusin. So I'm sure that directly with Dr. Rusin, so I'm sure that the member opposite will agree that that's a much better meeting to have than a meeting with me, and we help facilitate that. So I'm sure the member opposite will recognize that. But certainly, when it comes to our pop-up clinics across the province, you know, those pop-up clinics are based on the supply that we get from the federal government. It's often very last minute. And so, you know, so if with it being short notice, that is just the nature of the game through how this is all rolled out in Manitoba, especially when there's been a scarcity of supply from the federal government. And of course, that's the pop-ups primarily are the Moderna vaccine, as the member opposite will know, when there has been delays in the delivery of Moderna vaccines to not just to our province, but to provinces across the country. And so that has had an impact on, you know, sort of the notice sometimes with those pop-up clinics. And so that is nothing that is, you know, just to Northern Manitoba. That's to all of our pop-up clinics, and something that, you know, quite frankly is beyond our control because, of course, the member opposite will know those. You know, it's up to the federal government to issue the supply to the individual provinces. What I will say is that, you know, through our First Nations Vaccine Implementation Task Force, through our vaccine task force, as well as, you know, the Northern Regional Health Authority, they've done a phenomenal job in terms of getting the vaccine out to a higher percentage of those 18 plus, in fact, the highest percentage of those 18 plus of any other region in the province. And so I really want to commend those who have worked very, very diligently in Northern Manitoba to ensure that those vaccines are getting out to those who need it. And we, of course, want to continue to encourage all Manitobans to get the vaccine. Just as of this morning, we announced that all of those age 12 and up now. So that's everyone who's, you know, sort of the eligibility now of everyone across the country. The Pfizer vaccine is available for those 12 and up. And so, or has been clinically tested for those 12 and up. And we are now offering vaccines to all Manitobans 12 and up. So we encourage everyone to get out and ensure that their loved ones and family members and friends and neighbors get the vaccine, so we can, you know, get back to some semblance of normalcy moving forward for all Manitobans.
The Honourable Member for Thompson.
Thank you, Minister, for that response. I'm going to jump back to life flight planes for a moment. You indicated that there were 3 life flight planes in Manitoba. Who owns and operates them? Under what terms? And what is their staffing complement on each plane, i.e. how many doctors, nurses are on each plane?
The Honourable Minister.
I thank the member for the question. The member will know that any sort of contractual services with respect to, life flight services and so on, that's done through central services. So is more appropriate to ask those questions in the estimates for that department. When it comes to the complement of doctors or nurses or staffing on the plane, that obviously comes under health, but it varies according to the individual case. So it's very difficult to give, a concrete answer because it's based on individual cases.
The honourable member for Thompson.
Thank you. I will now hand questions over to the honourable member for Kawatnuk.
The honourable member for Kiiwetinoong.
Thank you, Mr. Chair. Is my audio and video coming across okay?
We can hear you properly. You've been sort of froze on the audio, video side. Yeah, but we can still see you.
Yeah. So I'll point out that I was not. I'll point out that I was not included on the list for the newly announced upgrades. I searched high and low on the 5 pages that was put forward, and I'm not on that list. So it's a work in progress. I have a couple of COVID-specific questions of the minister, especially because, well, of course, right now we're right in the middle of the pandemic, in the middle of the 3rd wave, and hopefully not have to deal with a 4th wave at some point in time. For the Pine Falls facility and the Pine Falls capacity that's existing currently right now, and with the surge in cases, the surge in variant cases, I'm just wondering, is there any plan to expand the hours of operation, maybe the daily operations, to be able to help with the potential overload that's coming forth for the Pine Falls COVID testing facility?
The honourable minister.
Sorry, just for clarification, you're talking about testing or the vaccination?
The honourable member for
testing.
Kiiwetinoong. The honourable minister.
I thank the member for the question. I know the vaccine, the COVID-related questions are sort of back and forth with some staff between the Executive Council estimates and ourselves. But what I will say to the member is that we're always looking to either, if we need to, this has been an ongoing, and there's been so many moving parts with respect to COVID and with respect to testing, that if we need to expand hours of operation, the team is looking at those to see if it's needed. And so, I rely and we rely on the advice of our team that is responsible for this specific area. And certainly, I can let them know that you've had this maybe concern and bring that back to them and ensure that if there is a need there, that we do increase the capacity for testing.
The honourable member for Kiiwetinoong.
So maybe a little bit further more to that, then, being, of course, the northern health area, the eastern health area is, the dynamic is a lot more different than Winnipeg, for example, being able to access, being able to travel and get around in the area to various sites, various organizations, various urban areas. Is there a plan to have that mobile testing more available to these communities, and more so to that, maybe rapid testing? And why I ask that question is rapid testing, because isolations are proving to be a lot more difficult in remote communities and further in further out communities from urban areas. So I'm just wondering if mobile testing and rapid testing will be made available to those communities to help kind of alleviate and help with the tracing and the potential difficulties with having to isolate.
The Honourable Minister.
Yeah, no, I think the member for that question, and certainly, having been in many of the northern and interlake eastern communities, I recognize in some of our rural communities as well. Recognize certainly that there are challenges that we face with respect to the remoteness of some of these communities, and we need to ensure that we have the access within those communities. And I'm happy again to take this away and talk to our task force about this to ensure that we do have access. Whether mobile testing is an option there in some of these communities, and certainly get back to the member on that. With the rapid testing, we are looking at ways. Until more recently, we weren't utilizing, extensively the rapid testing. We were moving more towards the PCR test because we had the capacity within our lab systems to be able to do the PCR test. They're obviously much more reliable than some of the rapid testing. But as we're moving into some of these, as our numbers are starting to go up, our PCR testing numbers are going up. We are expanding into our rapid testing and utilizing that in many locations across the province, and certainly I'll bring that to our task force to have a discussion about that as to how we can increase access to testing in some of the more remote communities. So I thank the member for bringing that forward, and we'll certainly look into that. I think it is a good idea, an important idea to ensure that people in more remote communities have better access to the testing.
The honourable member for Kuwait-Nook.
So will a threshold be established? Will there be something to trigger the ability to in mobile testing, in rapid testing, or will that request have to come from various community leaderships, or is there some kind of number? I mean, it's all for the same because the number one is already more than enough numbers already to be able to trigger something like that. But is there a threshold that will then be established to be able to trigger that? For example, there was a lot of rapid testing, mobile testing went into flying communities over the winter, but that was triggered by severe outbreaks and the inability to actually know exactly what was contained. And I realize there's a lot of employers that actually use rapid testing for their employees just to be able to make more or less peace of mind. It really doesn't go into the provincial figures and things like that too. It's more from a community and a work perspective. But I'm just wondering, will there be a threshold established in, or a percentage to be able to do that?
The Honourable Minister.
Yeah, no, I thank the member for that question. Obviously, as I just mentioned to the member for Thompson in a question that she had asked, Northern Manitoba has sort of the highest percentage of people vaccinated, those 18 up. And of course, we just dropped that age to 12 today. So our focus is still going to continue to be on the vaccine, but I know Northern Manitoba has been very good in terms of rolling that vaccine out, which is obviously the key. But in terms of the testing, I don't believe there's a specific percentage or anything along those lines. But I know we've had this conversation now, and I think it's just something that's worth bringing back to the table with respect to discussions here around the testing. I'll certainly bring it to their attention that there could be an opportunity here to increase the mobile testing or rapid testing in some of these communities. These are the types of partnerships that we're looking for now. And so, we'll see if there is a need. That we obviously want to encourage people to get tested as well. So for those in more remote communities, I don't think there's a threshold. I think it's just, it's a matter of going back and just seeing what makes common sense, frankly. So we can certainly continue that discussion, offline if the member opposite wants to.
The honourable member for Kuwait-Nook.
Thank you, and I thank the minister for those responses. The minister touched on the announcement this morning of the vaccine and the vaccine now being the age being reduced. And for just a conversation here, we'll just say to minors, we'll call it that. But the announcement was also specific to basically the Pfizer vaccine. And as the minister is aware, I mean, the travel, the transportation logistics of the Pfizer vaccine to remote communities was an issue. So primarily, northern and remote communities received the Moderna vaccine. So I'm just wondering where along this line will either Pfizer be available to go into remote communities and be able to, or is it going to be specifically Moderna, and then the First Nation communities that are remote and isolated have to wait for the Moderna vaccine to be approved provincially to be able to go to minors?
The Honourable Minister.
Yeah, no, I want to thank the member for the question, and it is a very good one. And I think what has transpired over time is that things have changed. We need to be very nimble and flexible with these changes that are taking place with respect to, the vaccine, in particular, those mRNA vaccines that need to be stored at very low temperatures, in particular the Pfizer vaccine. And so, and this is the one, obviously, that has been tested for those 12 to 17, I guess, 12 and up. One thing that has transpired so far is that through Pharmacists Manitoba, there has been a pilot just to test on the, about the temperature and stability of the movement of the vaccines, from the super sites. And so that has been ongoing. We're seeing some positive results from that. And certainly the manufacturer themselves, there's been some loosening of those restrictions from the manufacturers when it comes to the temperatures and the stability of the vaccine as well. So I think we've come a long way. And then obviously we're going to work very closely with our First Nations vaccine task force, as well as our vaccine task force, and we'll all work together to ensure what is the best and most efficient, effective way to get those, between the ages of 12 and 17 vaccinated as close to home as we possibly can. So I know those discussions have all been taking place over the course of the last while, and I'm sure there'll be more announcements. As the member knows, we do have, every Wednesday, our co-leads of the Vaccine Implementation Task Force do go out and give technical briefings and briefings to the public as well about these kinds of questions that are coming up. We're very aware of the fact that these questions will be coming up with respect to rural and northern remote communities. And I think, sort of from day one, we've always been cognizant of the geographical challenges that we face as a province. And it's why we implemented sort of those pop-up, the pop-up sites, the fit teams that would go into our congregate care settings to really ensure, and that we have, our super sites in all 5, health regions. But I think it's really important to know that we do understand, and we do have a lot of respect for those that live in rural and remote northern communities. And this is definitely something that we have been looking at, and that will, I'm sure the task force will be out very soon in terms of what the next plans are for rural and northern remote communities.
The honour member for Kuwait-Nuuk.
Yes, I'd like to pass the next question on to my member from the Paul Kamisak, please.
Okay. The honour member for the Paul Kamisak.
Thank you, Mr. Chair. Good morning. I have a question about the Northern Patient Transportation Program. As a Northerner, we can all agree that program is severely inefficient when serving us when we have to travel to Winnipeg for medical. For example, we have seniors, elders, traveling back alone in wheelchairs while on dialysis after surgery. That is happening because of pandemic and limited flights from Calm Air and limited people. So, and other issues are that once we're medevaced out, including myself twice, it's up to us to get back on our own. And the travel, the assistance that we get is, again, severely inadequate. So my question is, as a fellow Northerner, and for myself and for my family, is there any plans to look at this Northern Patient Transportation policy to help us feel a little bit better and safer when we leave our communities and travel to Winnipeg for medical services? Is there plans in the soon, very near future to relook at that policy so that we don't have to feel like second-class citizens when we leave our community for medical in Winnipeg? Eggleston.
The Honourable Minister.
I just want to thank the member for her question, and to say I'm sorry to hear about the fact that she had mentioned that she had to utilize these services as well, and obviously our thoughts go out to she and her family and to those affected by that. And so I just wanted to reach out that way. I also wanted to thank the member as well for bringing forward Bill 213, the reporting of supports for child survivors and Sexual Assault Act. I think that was a very important way where I think, we've been able to work together towards understanding some of the challenges that are being faced and how we can work together to overcome some of those challenges. And I think, beyond that, I know that one of the things we're sort of learning from COVID is that, there can be more of an emphasis placed on some virtual care where we can do it virtually. We have expanded that through COVID just to ensure that people get that access during these difficult times as well. I know the member will know that there's been a huge impact on air travel in general during COVID. And so that's been a huge challenge across the board. But essentially what we want to do through our clinical preventative services plan, our goal is to hopefully be able to reduce the number of those trips that are necessary to have to come into Winnipeg or go to other communities to get access to healthcare that can be delivered at home within their home communities. And so that is really the gist of the whole clinical preventative services plan. Of course, COVID comes into play and there's been, some delays there, but I think there's also some things that we've learned as a result of COVID that could help enhance the way that we, deliver medicine as well, closer to home. And so those are, some of the things that we're continuing to discuss with our clinical leads, our provincial clinical leads as well, just to see how we can, maximize the use of all of our hospitals all across the province, really take a provincial approach to medicine. So it's not just all about, having to fly into Winnipeg to get the access to care that, would be better to have access to, obviously closer to home. And so those are some of the things we're working towards right now.
The honourable member for the Paul Kamisak.
I'll go back to my colleague from Kiiwetinoong. Thank you.
The honourable member for Kiiwetinoong.
And I will tag in my member from Union Station.
Sorry, we didn't quite hear what you.
Member for Union Station.
Oh, Union Station. Okay, the honourable member for Union Station.
Hello. I love the teamwork. That's great. Good to see everyone. So I want to thank my colleagues for those questions. Thank the minister for her responses on them. There are a couple of questions that I have that I'd like to follow up on what my colleague, the member for Thompson, asked in regards to Lifelight. So can the minister provide details around the physicians that are currently on board for those Lifelight flights? Do all of the Lifelight response flights currently have physicians on board? And will the current existing contract be extended?
The Honourable Minister.
Yeah, I just want to thank the member for the question. And as I mentioned to the member for Thompson earlier today, the light flight contracts that's all done under central services. So those questions would be better put during those estimates process within the Department of Central Services. With respect to physicians, there's really, it depends on the medical condition of the call as to whether or not a physician will attend to those calls. So it varies, I guess, according to, whether or not a physician will attend on the flight or not.
The Honourable Member for Union Station.
Great. So specifically then in regards to physicians on the flights, depending on the case, how critical the case is in nature, the acuity, I get that, we determine if a physician is on board. I'm wondering though, there must be like a percentage, there must be data information on the percentage or number of times that a physician is on board those flights, attached to, of course, the reasons why. But in this case, for the purposes of right now, even a percentage around how often a physician is present on board would be great. It would be even better to know the circumstances typically, but just a percentage around how often those physicians are actually on those flights would be great.
The Honourable Minister.
Yeah, I think just in the interest of time, I don't have a percentage, here right now. We can endeavor to get that to the member. But, what I will say again, and I'll just reiterate that it depends on the medical conditions as well as other factors involved as to, whether or not a physician themselves will attend to a particular flight, but we'll endeavor to get hopefully get that information. If we have it, I think we should be able to get it at some point.
The Honourable Member for Union Station.
On that same note, I would ask if the minister could also endeavor then, just since they'll be doing that looking into, to also provide details around the complement of staffing on each flight. So as well as, the physicians attending, but if they could endeavor to provide details around, how many nurses are joining the physicians, the complements of nurses on those flights, I would greatly appreciate that. And then my other question would be, currently, who actually owns the planes? Who owns the life flight planes? Who's operating it and under what terms? I know we've already referred us to central services, but those are a bit more broad in terms of details. So who's operating rather the planes, under what operations, and who owns the planes? And if you have details around the terms, that'd be great.
The Honourable Minister.
Thank you, Mr. Chair. And I just wanted to say to the member, we'll endeavor to get more information with respect to the staffing on the flights. And also, I will just say to the member that I think the best area again to ask those questions, because it is a service that is contracted out through Central Services. I don't, know who individually owns the planes that would be utilized for the services that we use the planes for. So that question, I think, again, would be best asked under Central Services.
The honour member for Union Station.
Thank you, Minister. I appreciate that you'll endeavor to provide those details. Now, specifically, I'd like to ask some questions about nursing and agency nurses. So I'm wondering if the minister could provide some information, basically a dollar value in regards to the agency nurses last year in the northern region. So if you could provide, a monetary amount that was spent to hire agency nurses in the northern region.
The honourable minister.
Just for clarification, I wonder if the member could indicate, are they asking specifically for northern Manitoba or for all of Manitoba?
The honourable member for Union Station.
Give me one moment here. I'm going to clarify.
Okay.
Okay, so
Member
yes,
for Union Station.
My apologies. The data, specifically the monetary amount for the Northern Regional Health Authority.
The honourable minister.
It's 4 million.
The honourable member for Union Station.
Thank you, Minister, for that information. So I'd like to ask some questions now around surgical wait times That's an area that I know we're all talking a lot about. We're hearing a lot about from our constituents. I'm sure the minister is hearing from many folks. I know we've raised it in the House several times as concerns were brought forward from folks in the community. Those concerns brought forward were specifically in regards to women's health. But more broadly, I think it's important for us to talk about what's going on in terms of surgical wait times. Given here in Manitoba, you know, we haven't had as strong as response as other jurisdictions. I think about British Columbia and how they've addressed their backlog in surgical wait times. They've brought that almost entirely right down. I believe 95% cleared up. And here in Manitoba, we're just not seeing that issue being addressed in a way that is really sustainable or meeting the needs of folks. So I do want to ask some questions around that. And, you know, we know in January of last year that Winnipeg hospitals had 1,072 filled nurse positions in surgery. I can give you a quick breakdown. Concordia had 106 filled, corporate regional services, 3, Grace 174 filled, HSC 433, Misericordia 52, Pan Am 27, Seven Oaks 7, St. Boniface 198 positions filled, Victoria 72 positions filled. And we've seen the monthly data, and that number has not really significantly changed throughout the pandemic, which tells us that there hasn't been a ramp up of staffing in that area, despite the fact that, you know, I think all of us could have predicted that we need to staff up in that area. Not even between the waves of the pandemic has staffing been ramped up in those areas. And actually, in fact, by January of this year, so 2021, when the government said that it had restarted surgeries after the second wave, there were actually less positions filled than prior to the pandemic. So 1,036 positions were filled, by, you know, nurse positions filled in surgery. So again, less than before the pandemic, which is really concerning. Not only were those positions filled and ramped up, but they decreased. And, you know, every position counts. We know that. So my question for the minister is currently, right now, today, how many filled nurse positions are there in surgeries, for surgeries in Winnipeg?
The Honourable Minister.
Thank you, Mr. Chair. Just thank the member for the question. The member will know that in the budget, we have announced $50 million to go towards decreasing the wait times in surgical procedures in our province. So we've made that commitment. We're also working very closely with our provincial clinical leads to see how we can best, through our clinical preventative services plan, how we can look at this as sort of more of a provincial approach to surgeries. So obviously using the more emergent cases, those where we have the ICU, capacity, or the acute care hospitals for the more emergent cases, but also utilizing hospitals, say, outside of Winnipeg, to perform some of the, less emergent cases of surgical procedures within those hospitals, to be able to kind of utilize, the whole provincial approach to how we deliver surgery in the province. So those are the things that our clinical leads are coming up with, and I just want to thank them for the incredible work that they're doing. Obviously, the member opposite will know that we're into the third wave of COVID, and to the specific question that the member asked about nursing positions and surgeries in Winnipeg, this is somewhat of a fluid number. As we are, in the middle of the third wave of the pandemic, where, those positions, are sometimes being redeployed and so on in a voluntary way for right now. So these are, it's a very fluid number. It would be very difficult to get a concrete number for the member right now. We do obviously know, as I have mentioned before, that there is a challenge with respect to recruitment and retention of nurses in the province of Manitoba. We do know that it's nothing new, but we are putting some measures in place to ensure that we have, the capacity with respect to the nursing positions to be able to fill those positions. We are coming up with a sort of short, medium, and long-term strategy to deal with that. I think it's something that, particularly during the pandemic, that other provinces have been facing as well across the country. And it is just something that, it is a challenge that we've got. It is a challenge that we're embracing, and it is a challenge that we are working with our partners to ensure that we can increase that necessary nursing capacity within the provinces, within our hospitals.
The honourable member for Union Station.
I can certainly appreciate, and I thank the minister for that response. I can certainly appreciate, some of the impacts of redeployment and resources being reallocated where they're needed during this pandemic. To be clear, that shouldn't really disrupt the ability to provide clear information on how many positions are filled right now. We do know that, as restrictions were increased recently, there may have been some disruptions, but that shouldn't really impact the ability to provide this specific piece of information in terms of how many positions are actually filled currently in surgery in Winnipeg. So I would hope that detail, and we can have all the understanding in terms of what's going on right now, and apply sort of our logic to that. But that information should still be available and able to be presented. Now, I apologize. I'm going to kind of go back to a previous question. Hope that doesn't cause too much stress on your end on the end of the minister. But I would like to go back to the question that I asked about agency nurses in the Northern Regional Health Authority. I'm just wondering, when I think about the number that was provided, $4 million for agency nurses, it's a number that, with comparison to other years, would be much better to understand what that means within this context. So I'm wondering if the minister can also provide some information on the years before, like even 2 to 3 years before this period, if the minister can provide how much money was spent on agency nurses in the Northern Regional Health Authority for the previous 2 to 3 years.
Honourable Minister.
Yeah, I don't have the exact figures in front of me, but I know certainly that it has increased in the last year with respect to the hiring of agency nurses in northern Manitoba. And I think the important, obviously, issue there is that doesn't take away from our first and foremost, wanting to hire nurses internally to do the work in our hospitals and so on in northern Manitoba. So that is our primary, objective, is to hire nurses internally. But obviously, we never want to put any patients' lives in jeopardy or patient care in jeopardy, and so we do reach out to our agencies to hire nurses to ensure that we have the appropriate nursing capacity there to look after Manitobans. So I'll leave it at that. I did speak to, I know, the member from Thompson about that earlier today. I think you had a much more respectful way of asking these questions, and so I'm happy to provide those answers to you.
The honourable member for Union Station.
I thank the minister for that response. I'm wondering if the minister's acknowledged that number has increased. So I don't know if the minister has those numbers for previous years in front of her. It would be helpful to have those numbers concretely, what they look like. And I know that myself, alongside my colleagues, are really invested in making sure that, we work collaboratively to address the needs of Northern health needs and community needs, and finding solutions to some of the issues that exist. My colleagues that represent the North have a tremendous amount of expertise and great relationships in their communities and great ideas around how to do so. So certainly, in the spirit of working collaboratively to meet some of those needs and fill those gaps and address these issues, having the information certainly makes it much more realistic in being able to do that. So if the minister could provide some clear information around what those amounts were that were spent on agency nurses in the Northern Regional Health Authority for previous years, 2 to 3 years before this fiscal that she's already provided, would be really appreciated. And then I would like to ask for clarification as well for a question that I asked about LifeFlight. I realize that I should have maybe been a bit more clear. The minister did say that there may not always be a doctor on board depending on the case. But I want to be really clear that the minister was referring to LifeFlight and maybe not referring to Medivacs when folks are Medivac'd out of community. Can the minister provide some clarity on that point as well? I apologize. I should have asked for that clarification before. So again, my 2 points: if the minister has that information around previous dollars spent on agency nurses in the North, and as well, just to clarify, the doctors being on flights or being a part of that transportation, if she was speaking specifically to LifeFlight or Medivacs.
The Honorable Minister.
Yeah, so just with respect to life flights, yeah, we were referring to life flights, yes. And that's been, as I understand, a long-standing sort of agreement or whatever for years and years. So that's there's nothing new there, nothing that's changed as a result of that. With respect to the numbers for the nursing, I don't have them like right in front of me right now. I said that because I do recall that it is up slightly from last year. I mean, that could be for a whole host of reasons where, you know, we're in COVID and obviously, you know, we were asking people to stay home if they're sick and so on. And so we had to obviously reach out to agencies to help fill those positions in the interim. So there could be a number of reasons for that. I don't have all of those in front of me right now, but you know, that's what I've got.
The honourable member for Union Station.
I thank the minister for that response. She can anticipate that I'll be following up on those details in particular. I do think that information would be really helpful and is important for us to be able to compare and understand what's going on and why and how to address those areas of concern. So now I'm going to go back to the surgical wait times issue. I believe the minister was not able to provide details on how many positions are currently filled. As I mentioned before, you know, I understand there's a lot going on right now, pandemic obviously, and redeployment and all of that. We should still be able to get a sense of how many filled surgical nursing positions there are in the city of Winnipeg. And so if the minister is able to find that number, that would be greatly appreciated. But my other question on this front is, you know, why wasn't that ramped up? We know that wasn't ramped up between the waves of this pandemic when, you know, that would have been an opportune time to do so and make sure that before we potentially see a third wave, that we've got more nurses in those positions, given the impact that we saw it had on surgical wait times. And certainly given the efforts that we can look at, again, I referenced British Columbia in terms of them bringing those wait times down and essentially eradicating them, dealing with their backlog almost entirely. So just wondering, you know, why didn't the minister ramp up capacity in surgical wards between the waves of the pandemic, as it's been done successfully in other jurisdictions?
The Honourable Minister.
Thank you, Mr. Chair, and I just thank the member for the question. And certainly, we do know through the pandemic, through the first wave, second wave, that obviously we had to redeploy staff, and some elective surgeries were postponed at that time. And that's nothing, unique to Manitoba. That was across the country as well. During that time in the interim, between some of the waves, obviously we had some of our partners like Cancer Care Manitoba, Western Surgical Center, and others sort of step up to help out with some of those procedures and to take some of the load off of our hospitals at the time, which helped a little bit in the interim. Obviously, we did make an announcement. We recognize that there are some challenges as we're going into the third wave as well. There are challenges with respect to, staffing and so on. We do recognize that there are surgical backlogs that need to be addressed. It is why we announced $50 million towards this end as well. And we will continue to work in a sort of pan-Canadian or pan-provincial approach to dealing with this issue.
The hour being 12:30 p.m., committee rise, call on the speaker. The hour being 12:30 p.m., the House is adjourned and stands adjourned until 1:30 on Monday p.m. 1:30 p.m. on Monday.